there are some amazing people here at this hospital. The doctors, the nurses, the physicians, the residents, and we take great care of these kids. But there are some clear infrastructure issues here. Okay, I've been coming here for 20 years. There's some very clear infrastructure issues that need to be solved. You know, I made a request 2 months ago when we heard the air conditioning issues. I said we need to fix it, or you need to make accommodations somewhere else. Now the fact that they want to make accommodations, make the decision today to do it tomorrow, that's not right. That's not right for the patients. You know, and my request was ignored. So I think that if you know, this is the only children's hospital currently on the hospital in the island. We're probably the most technologically advanced Caribbean island in healthcare wise. We have to be the gold standard. Our hospitals have to be the gold standard, and we have to. People come from other islands so we can take care of their children because we know that our healthcare system is good, and we have to maintain that. And so we have to go through the hospitals, make sure you're absolutely correct. The autoclave systems are working. You know, we can only do single instruments now. That's an issue. The air conditionings have to work, and we understand this is an old hospital. There's other things that we need to do to fix it, but these need to be addressed and fixed, and the money needs to go into helping these children. And I come here twice a year. I bring a whole team where we donate thousands of dollars of equipment because we want to help these people. And you guys have to put the infrastructure in place for allow us to do that. It's absolutely necessary.
Such a big disgrace by the Jamaican Labour Party and Christopher Tufton. Now, when you look and you see a foreign surgeon, an American surgeon, criticize our healthcare system, criticize the healthcare minister of Jamaica, then you know say something really bad. Now, when we, the vlogger and the bloggers, them criticize the healthcare system, people say we are trying to bring down Jamaica, and we are this and we are that. Knowing that are the truth we attack, but yet still some of them are so hard to accept the truth. Now, me want them tell the foreign surgeon say, I lie them I tell. Me want them to do that. Now, people, when you look into this, you know, a little child, right, want to do a surgery or should do a surgery, but when you check it out in the surgical room, there is no air condition. No air condition. So the surgery could not take place at the children's hospital. Now, that is really bad. That is really bad. And when you look at it, Andrew Holiness and Christopher Tufton keep on at about economy this, economy that, and healthcare this and healthcare that. You guys are a bunch of mess. Without apology. Andrew Holiness, Christopher Tufton, and the whole Jamaican Labour Party need to resign right now. That is what causing so much life. So much life are lost whenever they went into the hospital. Most of these hospitals don't have any air conditioner. Them a leak. Just like over there in the Falmouth Hospital. The patient, them are wet up. Them are wet up because, why? The ceiling of the hospital a leak. So whenever rain fall over there in Chilani, the Falmouth Hospital flood out. The patient, them flood out, them wet up. And then Christopher Tufton cannot give account for $700 billion that should spend on the healthcare system. They are bringing down Jamaica. They are destroying our healthcare system, and they need to go right now. And if you don't believe these criminals need to resign and go to prison, then leave a like on this video and type prison in the comment section. And also share the video. This is a national disgrace, an international disgrace by these criminals that are robbing the poor, that are thieving from the poor people purse. And the healthcare system are popped down. Can you imagine that? Can you imagine that? But bless up to my viewers and my subscribers them. May hope everybody having a blessed and a wonderful evening. Now, my viewers and my subscribers, remember, in everything you do, always put God first. In every and any situation, just always remember to call upon God. Always remember to pray, because a prayer day keep the devil away. Now, my viewers and my subscribers, we have a lot coming up inside this update, so you definitely don't want to miss none. Just watch the video until the end. And remember, like up the video, share the video, and subscribe if you haven't subscribed as yet. Make a run the intro and come back. We soon forward. Welcome back to my viewers and my subscribers them. Big up to all of my viewers, big up to all of my subscribers them. We continually support the channel and help the channel to grow. Now, remember to leave a like on this video. Remember to give this video a thumbs up. Also, if you're a new viewers, first time on my channel, then please subscribe to my channel and turn on the post notification bell, so whenever we drop new content, you will be first to be notified. Share the content with a friend, a family, a loved one. Share it on your social media platform. And viewers, remember, we are on our way to 100,000 subscribers. So if you're not subscribed yet, now is the right time for you to subscribe. Turn on the post notification bell for new content. Alright? So now, back to the story. Now, a little girl or a little boy, one of them, were to do a surgery, right? And because there is no hair condition in the surgical room, they could not do that surgery. Now, when you check it out, people, that is really bad, That is a national, international, and worldwide disgrace by the Jamaican health system. They are a national disgrace. Christopher Tufton should resign.
They're Jamaicans. Before TikTok existed, I have been on social media complaining about the ills of the Jamaican healthcare system. So, me want to know, or no, I go wait until an American-based orthopedic surgeon go public and to convince you to say the health sector pop down. Meet Dr. Robert Brady. And no, he's not a comrade. He's an American orthopedic surgeon who has been coming to Jamaica for the past 20 years to perform orthopedic surgeries on needy children. Sometimes these surgeries are life-saving. He's here now and he has been performing surgeries. Now, he was supposed to perform a life-saving surgery on an 11-year-old girl, can't remember her name, who has an 85-degree angle scoliosis. If in layman's term, that is a very, very bad scoliosis that compromises the health of her organs. This surgery was not, they never get to do this surgery to save this child's life, right? Why? Because the hospital's operating theater was not ready. Why? Because the AC unit in the hospital operating room don't work. And the type of operation, it's a 68-hour-long operation. They need the AC for your work. And say one AC unit in a one operating theater, the little picnic never get our surgery. And then you have this bloody idiot talking about the system defects. System defects are not budgetary concerns. You're damn right it's not a budgetary concern, because you all gave yourselves all of these nice salary hikes while the hospital infrastructure them falling apart. And people who come from foreign to the surgeries, experts who come to Jamaica to do surgeries for free, can't do the surgery them for free. For people who would never be able to afford those surgeries. Why? Because there is no infrastructure. I'm glad it's an American say it. So now, Tufton is talking about is not a monetary problem. So then why you don't fix the damn AC, Dr. Tufton? Why you don't fix the damn AC? Are you gonna say the PNP didn't fix it 8 years ago when they were in power? Well, Mr. Tufton, if you did buy a brand new AC unit 8 years ago, that AC unit would have to change again by now in an operating theater. So whatever it is, fix it, because you can't PR yourself out of this one. It is sickening how you people run down the health sector and then you try to blame the previous administration because you won't do your job. But I'm glad people wake up and say, are you are the problem? Because me tell you say you are the problem from 2018. From 2018, I've been telling you that you are the problem. I'm just glad that Jamaica finally wake up and see you are indeed the problem. And we need a new, I was going to say we need a new minister of health, but we need a whole new government to rot it. I thank you having yourself a great day.
We need a change. We definitely need a change. We need a change of government. We need a change of health system, education system. We need everything to change because these people have wrecked every single thing at this given moment. The Jamaican Labour Party are a destruction to Jamaica. And that is why we are calling on them to please just step aside. Andrew Holiness, you and your minister, you and your criminal organization, please to step aside and leave us, the Jamaican people, alone. From ever since you come in power, it is a destruction. You have become a destruction, a disaster to our country. And you should resign, your wife should resign, and the whole parliament and the Jamaican Labour Party side should resign on a destruction. And I know say no for no run combo. PNP can't do no better because ono just brainwash. Ono brainwash by these Nikompo, by these criminals.
Bills brought from the Senate, petitions, papers, reports from committees, notices of motions given orally. On the questions and answers to questions, Dr. the Honorable Christopher Tufton is to provide a response to question 1, standing on the question notice paper. I believe he is ready to do so.
It is a national disgrace.
It is standing.
The government of Jamaica and his ministers is criminal organization.
The member from St. Andrew South.
Of the people.
There's no prompt, but I'd be grateful if the question standing in my name could be answered.
Jamaica deserves better. And we want better. And if you don't want better in the comment section, and type it and like the video and share the video. This current government is a national disaster and a national disgrace and a national embarrassment.
Thank you very much, Madam.
To the people of Jamaica.
Madam Speaker.
And they should resign. And we
as a response to these questions, Madam Speaker, I'd just like to outline that
right now.
They are quite lengthy.
And if you don't want to resign,
Madam
let me
Speaker,
know below in the comment section. And remember, leave a like on this video. I'm going to leave you with this video right here, right now.
Madam Speaker, I just like to outline that the questioner, my colleague on that side, asked a number of questions, so it's quite lengthy, the responses. So I just want to crave your indulgence on members of this House as I seek to go through. All right, so question 1, are there 11 HDUs, that's high dependency units, spread across 6 hospitals in Jamaica that were acquired under the PROMAC? If not, how many HDUs are there in Jamaica and how many hospitals have them? Answer, no to question A, 1A. In keeping with the objective of the PROMAC, 7 neonatal and maternal high dependency units were placed in 4 hospitals. Maternal and neonatal high dependency units at Cornwall Regional and Mandeville Regional were initially included to arrive at 11, but the project scope was later adjusted. Note should be made that although infrastructure was not provided for Mandeville Regional Hospital and Cornwall Regional Hospital under PROMAC, the project provided equipment that equips existing spaces to provide neonatal intensive care unit services at those institutions. 6 hospitals therefore benefited from the project as was initially conceptualized. 3 maternal HDUs, this is high dependency units, were built at the Victoria Jubilee Hospital, the St. Anne's Bay Regional Hospital, and the Spanish Town Hospital, with a total of 17 maternal high dependency beds. 4 neonatal HDUs were built at the Bustamante Hospital for Children, the St. Anne's Bay Regional Hospital, the Spanish Town Hospital, and the Victoria Jubilee Hospital, with a capacity for up to 50 neonates depending on the type and intensity of the support required. In addition to PROMAC HDU, Madam Speaker, colleagues, there are ICUs and HDUs throughout the system that can provide care for the general population, including maternal HDU care for those hospitals that do not have a specified maternal HDU. These hospitals include the UHWI, that's the University Hospital of the West Indies, Cornwall Regional, Falmouth, and Mandeville Regional. In terms of the University Hospital of the West Indies, this is a tertiary hospital and one of the major referral centers in the island. It has intensive care and high dependency care capacity. This hospital has 2 ICUs, ICU A with 10 beds and ICU B with 8 beds. There is also a high dependency unit that has 3 beds. UHWI also has a neonatal intensive care unit with 5 beds. There is no specific maternal high dependency unit, and patients are admitted to the general ICU. 2, Southern Regional Health Authority. There are 4 hospitals in Sierra with capacity for high dependency or intensive care. These are Kingston Public Hospital, Victoria Jubilee Hospital, Bustamante Hospital for Children, and Spanish Town Hospital. The KPH has 7 ICU beds and 4 high dependency beds. Victoria Jubilee, with the expansion from PROMAC, can accommodate 16 beds in the neonatal intensive care unit and a maternal HDU with 7 beds. The Victoria Jubilee Hospital will start using the PROMAC maternal HDU this month. Split units have been put in place to allow the space to be used, and a contract has been signed with CAC to fix the central air system. So there are some challenges there which we're trying to work through, Madam Speaker, colleague. The Spanish Town Hospital neonatal intensive care unit has 6 cubicles and 2 isolation rooms that can accommodate a total of 10 cots, and the maternal HDU has 5 beds. There has also been the conversion of a ward to a 4-bed HDU, as well as an isolation area created that can accommodate 10 beds that can serve as an HDU. The Bustamante Hospital for Children has a 5-bed ICU and a 10-bed cardiac ICU. The PROMAC neonatal intensive care is functional and is presently housing the special care nursery. Critical cases are managed in the neonatal ICU, but patients requiring mechanical ventilation are managed in the general ICU. With the expansion of plans for Spanish Town Hospital under the health system strengthening, Madam Speaker, there will be an additional 6 ICU and 6 HDU beds that will be established at that location. Capacity is also being developed at the National Chest Hospital for 5 HDU spaces. 2 are presently functioning. In terms of the Western Regional Health Authority, there are 2 hospitals in the Western regions with capacity for high dependency or intensive care. These are the Cornwall Regional Hospital and the Falmouth Hospital. The facility at Falmouth Hospital is an extension of the Cornwall Regional Hospital in response to the relocation of services from Cornwall Regional due to air quality issues. Presently, Madam Speaker, at Cornwall Regional, there are 4 HDU beds and 6 potential neonatal intensive care spaces, that is, spaces that can be created if needed. The ICU at Falmouth Hospital has 2 functional spaces. The return to the Cornwall Regional Building will see re-establishment of 8 ICU beds, 40 HDU, including maternal HDUs, in HDU beds. And the Western Child and Adolescent Hospital will have 15 ICU spaces with at least 4 neonatal intensive care spaces. So that is to come, hopefully, over the next year, Madam Speaker, additional capacity. Northeast Regional Health Authority, there is a capacity for high dependency care at the St. Anne's Bay Regional Hospital. This was provided through PROMAC and includes a 6-cubicle neonatal intensive care unit that also has 2 isolation rooms and a 4-bed maternal HDU that also has additionally 1 isolation room. The cubicles in the neonatal intensive care can hold 2 to 6 cots depending on the level and care being offered. The maternal HDU at this time can also be used for general HDU admissions. The Health System Strengthening Project, again funded by the Government of Jamaica, IDB, will build a 6-bed ICU and 6-bed HDU to provide a full complement of HDU and ICU capacity to the region over time, over the next year or so. Southern Regional Health Authority. Southern Regional only has HDU capacity at the Mandeville Regional Hospital, where a 2-bed HDU has been put in place. There is a neonatal intensive care with 7 spaces. Additional capacity is needed, and we accept that in this region, as it depends heavily on transfers to Sarah or Western region. So where we have an overflow, we do transfers. All hospitals with surgical services have a recovery room, Madam Speaker. Recovery room spaces are not counted above. For hospitals with no HDU or ICU, patients may be temporarily managed in the recovery room where the support services will exist, while transfer is arranged to hospitals with capacity for HDU and ICU care. This capacity is not only dependent on a space or a ventilator, but also skilled staff and supporting diagnostic and treatment services. In terms of ventilators, Madam Speaker, the number of functioning ventilators vary from time to time dependent on if ventilators are out for servicing or repairs. I think we have spoken to this recently with the discussions around ventilators. While this is desirable, not all potential ICU spaces have a ventilator, as other measures may be put in place to aid ventilation, such as CPAP machine used in neonates, which keeps the airways open, or patients may be able to breathe spontaneously but require other critical intensive support. For example, persons with injuries such as severe burns, or patients previously on ventilators may be weaned off the ventilator as their condition improves. There is always a need, of course, based on the question asked, for more ventilators, but it is true to say we have more ventilators in the system now than we have ever had before, largely influenced by the COVID pandemic, Madam Speaker. And that ranges at any one time from 80 to 120. How many of these PROMAC are functional as of June 1, 2024? That's a question. Of the 7 HDUs provided by PROMAC, 6 are functional, 2 at Spanish Town Hospital, neonatal and maternal, 2 at St. Anne's Bay Hospital, neonatal and maternal, 1 neonatal at Victoria Jubilee Hospital, 1 neonatal at Bustamante Hospital for Children. Work, as said earlier, is presently underway to restore services at the maternal HDU at Victoria Jubilee, which is the only unit not operating at this time. There were no HDUs provided for Cornwall Regional and Mandeville Regional under PROMAC. However, Madam Speaker, colleagues, with equipment provided under PROMAC, the service is being provided. So PROMAC did provide equipment, and those equipment have been deployed at those institutions, even though a specific area was not built out under PROMAC. Also, UHWI and Falmouth HDUs not provided through PROMAC are functional. Number 2, how many doctors and nurses have been trained under PROMAC, the PROMAC program? Total of 100 doctors and 154 nurses have been trained in specialized areas. B, how many of these cohorts of doctors and nurses have left the public system? That is to be determined, Madam Speaker. Archive training registry were retrieved, however, we have not yet confirmed the status of the 254 trained doctors and nurses with the Human Resource Department in the health regions. So a little more work has to be done there. But it is fair to say that we have lost some to migration and international recruitment. How many of those doctors and nurses are still employed? And the response would be the same. That is being checked to try and get the exact numbers. Note, however, that the development and review of guidelines for management of priority disorders in pregnancy and the perinatal period continues. There is training done annually on these guidelines to continuously equip new and existing staff to manage these patients. In addition, maternal and neonatal deaths and near misses are reviewed and services are improved to address any outstanding issues. In other words, Madam Speaker, colleagues, the training is ongoing every year. So whether they are new persons or persons in the system, they have to go through refresher or additional training. How many ambulances, 3A, how many ambulances have been acquired under the PROMAC program? And B, as of June 1, 2024, how many of these ambulances are in operation? Madam Speaker, 6 Mercedes-Benz ambulances were procured and delivered to support the following institutions: Alexandria and Chapelton Community Hospitals, Mandeville Comprehensive Clinic, Anato Bay, Savlamar, and St. Diego Health Centers. Of the 6 PROMAC ambulances, 3 are functioning, and 3 at the time of preparing this document were out for repairs. Now, it's a kind of statistics with explanation, which I appreciate you're allowing me to do. The Mercedes-Benz ambulances have been challenging to keep in service. They do not handle the terrain very well, according to the technical team involved in maintenance of these vehicles, especially in rural areas. The parts have to be sourced from Europe and are usually not stocked here, and there are long waiting times to receive parts. Also, they have been very expensive to repair. We have just received parts for one of the ambulances that is in for repairs. Another is waiting repairs, and one in Savlamar have been down for prolonged periods, repaired at a significant cost, and down again as this was being prepared. It is now being assessed to determine the way forward, whether we should take it out of service altogether or try to repair it again. However, the Ministry of Health and Wellness and the regional health authorities have been continuously adding to the fleet of ambulances island-wide, Madam Speaker. So if it's not being done by the Mercedes ambulances, then it's done by a Toyota or some other make. And just to note, in terms of data, there are 58 working ambulances across the regional health authorities, 12 in Sierra, 14 in Nera, 12 in the western region, and 20 in southern region. These number includes the PROMAC working ambulances, which when I checked in a 2017 report, Madam Speaker, we had 42 working ambulances in the regions. So we have actually increased the numbers and continue to increase the numbers. In fact, there are some on order now as we speak. We're now 16 ambulances above what was the case in 2019.